If you're like me, you are trying desperately not to catch anything in the next few weeks to protect your vacation plans. Please, Jesus. But these days we have more to worry about than COVID. The flu is going around too in an unusually long season. It has been 4 decades since a flu season peaked this late in the year. Why is this happening now? How much does COVID have to do with it? And what should we know about getting a flu shot at this point in the season? Let's get into all that with Professor Robert Garry, a virologist from Tulane University. Professor Garry, welcome to the program.
Pleasure to be here.
So why is this happening? Why is this flu season peaking so much later than usual?
You know, nobody knows for sure, but there are a couple of possibilities that could explain it. The strain of the virus has probably changed a little bit. The vaccine that we were all given, or a lot of us were given, maybe doesn't protect against the current way the virus is presenting itself quite as well as it did when that vaccine was made. And then the other reason is probably COVID. A lot of the restrictions about meeting with people in groups and wearing masks and things have been relaxed in a lot of places. And it turns out that those same interventions that were helping to prevent the spread of COVID-19 also help prevent the spread of flu. And if we take those away, then there's an opportunity for all these respiratory viruses to spread.
You mentioned this strain of the flu, and there we can see the positive test rate by week. That blue line on the bottom is the current flu season, and those gray lines behind it are previous flu seasons from the beginning to the number of weeks in. As the gray lines get lighter, the flu seasons go back in time. So it's kind of like you're looking straight ahead back in time, and we can see how the peak is going up as those previous seasons had already kind of ended. Is this strain an uncommon one? Is it just one that this particular flu shot was not designed for? What do we know about this current flu strain?
Yeah, it's called the H3N2 strain, and it's a common strain of influenza virus. It hasn't really caused a pandemic since I was in high school back in 1968 or 69, so-called Hong Kong flu. But it's a modern version of that virus, and it's basically a virus we see pretty commonly. What's unusual this year is the peak that's late. Usually the flu, as you saw in those curves, peaks sometime in February or March, and a peak in May is pretty unusual.
Well, take a look at the positivity rate of this flu season, because there are kind of 2 peaks if you take a look at the graphic. It looked like the season was going to peak in December, and then it came down, and then it went back up in like mid-April. There's a zoomed in graph from this year, just October to April. So it kind of went up, went down, and then psych, and turned right back around and went back up. What's up with the 2 peaks? Is there any rationale for why that would happen?
I mean, something happened. About that time, people started meeting with other people in groups, going to concerts, holding parties, things like that. Conditions where, we hadn't seen in the past, couple of years, the COVID years. And it just turned out that that was an opportunity for all respiratory viruses to spread. So, we got the flu. We got this strain that, is pretty good. And, we're seeing surges of cases in places like New Mexico and Colorado for the most part.
Yeah, if you look at the week ending April 30th in terms of flu in the U.S., it's pretty apparent that New Mexico got hit really, really hard, and then Colorado was not far behind. Now, I guess me naively would think you have large gatherings of people, you're going to expect to see spikes of different respiratory diseases thereafter. Coachella was just in California, and we're going to have all kinds of events all over the country. We got Lollapalooza coming up in the Chicago area. New York is going to have a slew of events this summer, but I don't know if it tracks that directly. Like, I can't think of why New Mexico would be the target right now.
It's hard to track it that closely. We don't know. I mean, the virus just happened to get into a few populations. It could have been any type, school, concerts, other types of meetings. It just got into a group of people, and then it was able to spread, across that state. It could happen to any state, any area, any time. We just don't know how to predict that.
Have we ever seen curves like this before that are this late in the year that might give us an indication of how long it would take for us to get back to kind of more of a normal rhythm with the flu, maybe like a few years out from more of the worst of COVID, presuming we don't have another major COVID strain? Is there any outlook for when this might normalize based on historical flu seasons?
It really is difficult to say. I mean, COVID may have a long-lasting impact on us. I don't think we're quite out of the COVID-19 pandemic either. We're seeing some new strains of that virus, the BA.2.12.1 strain that's circulating, in the Northeast, but also in the Midwest now. We're starting to see cases, rise there. So, we're not out of that pandemic yet. Will it have a long-term impact on other respiratory diseases? Well, certainly in the past 2 years, it's had a dampening effect on flu. I mean, the numbers of cases of flu in 2020 and 2021 were extremely low. I mean, that was just almost mind-boggling to people like myself who follow and track these kinds of things. And so that was highly unusual. But it most likely had to do with people wearing masks and restricting their interactions with other people. Now that that's been relaxed a little bit, viruses like flu and certainly SARS-CoV-2, are having a bit more of a free rein.
SARS-CoV-2, the technical name for COVID-19. So before I have to let you go, what should we do? I mean, is it too late to get a flu shot? Is it worth getting one? Should we stick to the same kind of COVID restrictions we had before? I mean, people are going to travel. I would really, really like to take my vacation this summer. I'm crossing my fingers and toes.
No.
Please don't cancel my vacation.
I mean, I think we need to wait and see what happens with some of the COVID strains and the like. Let's hope for the best that the cases don't go up too far. What you can do, though, even this late, is to get an influenza vaccine. It's not too late. The pharmacies will still give them to you. If you haven't gotten your COVID-19 shots either, you can take those both at the same time. So even though it's late, even though it's unusual, I think it's still a good idea if you haven't gotten vaccinated to get both of those vaccines. And the most likely thing, if you get the vaccines, is that will keep you out of the hospital and keep you from dying from either one of these, pretty severe respiratory diseases.
Professor Robert Garry of Tulane University, appreciate you breaking this down for us tonight. Thank you very much.
My pleasure, Joshua. Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.